needs. I'd like to open the discussion now and ask you if you have any comments or questions for our panel. Could you please also identify your name?
Yeah, my name is Toby Massa. I'm with Bristol Myers Squibb. This is more a comment than a question. Ms. Flannery made some rather interesting comments that I think we're dealing with an issue with FDA on, and that is the issue of units. If we are really to be seeking harmonization, this issue of units is one that I think somehow we've got to get our arms around. And I know I'm not directing this at you because I know you have to answer to your commission. So I'm not shooting the messenger here by any means. At FDA, we have the same problem. In many countries that we file our applications in, we're asked to file in SI units, all of our data to be in SI units. At FDA, when we heard very strongly yesterday that they are seeking data standards and data harmonization, at FDA, we're asked to submit the data in standard US units. Now, in and of itself, I can understand trying to standardize within FDA, but in an environment in which we have so much interaction between regulators, that just doesn't make any sense. Plus the fact that you now have to maintain two data sets, in essence, write two applications. Somebody made the comment, well, even in ICH, you have a common technical document and you submit the same document to all three. It doesn't work that way. And if we are, that's a real small step to harmonization that can really have a very big impact. I mean, if we're looking for small gains that have impact, something like that, I think, really ought to be looked at, because this is something that we can achieve very, very easily. Thank you.
Thank you. I'm going to, Tom actually is also asked to provide comments, so I'm going to give the...
I'll try to make them quick. I thought they were terrific presentations. I had two comments on which I would love to get the feedback of the panelists. The first is on, I thought the nuclear regulatory example was tremendous because so much of the discussion yesterday focused on the intransigence or unwillingness of regulators to just harmonize, get together, adopt the same thing. And I thought your comments about the rulemaking process, which most people view as a bedrock of good governance, going out and getting notice and comment, leading to idiosyncratic or differences in regulations. And I know there is an effort afoot to try to use cost-benefit analysis or impact assessment to try to address that, particularly if it can incorporate differences internationally. And that may be one route to go, but of course it needs to be acknowledged that it's somewhat anti-democratic in the sense that the good governance that you're getting from the rule notice and comment process is you're subverting that because of the cost-benefit analysis, which may be justified, but it's an interesting point about this. It's not what most people focus on as leading to that divergence. On Lembit's presentation, I was drawn to the examples he put forward of good harmonization. The European Centralized Procedure or the African Vaccine Regulatory Forum. And we talked a lot yesterday in our small session about incentives. Why do regulators harmonize? And it seems in both of those cases, one involved a centralized procedure, a new innovative set of products that the regulators involved were really struggling to regulate. So therefore got together to address that. AVRF involved undeveloped regulators who also had limited capacity and an incentive to get together there. I wonder if those examples don't provide an insight that regulators engage in harmonization to make their job easier, and that job has to be made easier to the degree that it outweighs the short-term cost of harmonizing. And then in other circumstances, it's you really need such a strong framework or top-down political authority to force the regulators to take that short-term cost of harmonizing unless there's that incentive that might lead them to do it more organically. But anyways, I was curious for your comments on that.
Thanks, Tom. Let's pass that over to the panel at this stage because I think there's quite a lot of comments between from the first two commentators. We have plenty of time, so we'll get to everybody.
I think, the first one, the comment, is sort of a lessons learned. I think we're in a situation with our public input process. We're never going to make everybody happy. We're never going to have that situation, but understanding the different views helps us develop an approach that takes into account all the implications. The process that we have, we can hear all the different views, and I think people understand that. And it contributes to our goals of having an open and collaborative organization where stakeholders know that their views are heard and they have that opportunity.
Thank you. I would say this international units issue, I think it is really an issue because it's in several areas which comes up, and it is probably making the life of regulators in less resource settings really confusing and difficult. So they would like to rely on something they can understand what they rely on, and if there are different approaches, it creates a lot of confusion. And this is what what in the globalizing world you could say that, yes, regulators in a lot of the focus are really looking inside in the jurisdiction they're responsible for. But increasingly what they do has impact outside their jurisdictions. And this is something that is coming more and more. So the responsibility of taking national decision nowadays can't be probably looked in separation completely what is happening outside of the jurisdiction the decision is made. So it's increasingly need for trying to find some sort of a compromises to have a probably more harmonized approach to certain this type of issues which still needs a bit effort to try to get the things harmonized indeed. And of course, what is another thing that we are talking about the mainstream products where I think there is already some sort of a harmonization, but there are a lot of those products, well, radiopharmaceuticals, let's say, which is a completely area which is regulation not developed in many jurisdictions at all. People even don't know how to regulate them. And those who regulate them sometimes probably have over-regulated because to do these products, there are very few players. It's a very different ball game, very difficult subject. And again, it's a bit a neglected area. Blood products, to a certain extent, again, neglected area. So there are many product groups coming which probably have not really benefited yet from the harmonization, even starting, not to speak about, something like a common framework, how you make the decision, because even the baseline is not there. So there is still a lot of room and I think a lot of job to be done. Thank you.
Mohab Nasser, GSK. Good presentation this morning. I especially appreciated Lambert candid reflections. However, I did not see coming from you, Lambert. I think you reflected fairly well about some of the regulatory activities and the harmonization, scattered harmonization programs around the globe. What I see lacking in your presentation, and maybe that was by design, is a proposal to move forward. And maybe this is something for Stephen and Tom to take on. I would argue that the next step has to go beyond another regional or white paper or something of that sort. I think we know what's needed. We need an action. Thank you.
Thank you. Nathalie Strub from Drugs for Neglected Diseases Initiative. I would like to thank Dr. Hago for his presentation. And the difficulty we see sometimes when we talk about harmonization is the fear that we will increase the bar of requirements if we want to accept to have, alignment from strong regulatory authorities and possibly less developed regulatory authorities, which at the end may in fact delay access. So how can we ensure that this process of harmonization is going to promote better access to treatments? Thank you.
Thank you. We'll take two more. I know Steve also wants to make a comment. So please.
Hi, Nancy Carter Foster with the Department of State and the Commerce Department. I'm representing Commerce here today. This is a slightly different take on harmonization, resulting from conversations that I've had with radiologists and health advisors from an agency not represented here today, the IAEA. And those discussions were with respect to long-term impacts of radiation. That we are now in a society where there's lots of diagnostic screenings, x-rays, CAT scans, PET scans that are given every day, in many cases, to the same patients. In a background now of increasing use of devices which also give out radiation, computer screens, telephones, just going up and down on through the security for airplane flights, many people who are traveling lots of times. The discussion here in harmonization has been on industry and individual regulation of devices. Is there anyone, particularly maybe the U.S. Nuclear Regulatory Commission, but also in WHO, who's looking at the implications of the use of all of these individual devices and what is the limit for the general public, for a patient, not in just looking at individual exposures, but a cumulative impact of the exposures in our society, plus having all of these other exposures to x-rays. I mean, when you talk to a physician, they say, oh, it's incremental, it's so small. But I have not yet been able to find anyone who knows how much is the limit that we should be recommending. And since we're in the Institute of Medicine, perhaps harmonization and looking on the impact of patients might be useful.
I'm tempted to answer that question, but I'll ask the question, which is what I was originally intended to do, but it's related, and it's for Cindy. From my work in several different areas, environmental protection, radiation protection, and in medical products, the most fascinating examples of disharmony to me are when there's actual disagreement over science and what is protective of patients or the population between different companies, because if you can't get to that point of agreement, you'll never harmonize. So with regard to the radiation protection standard, is the difference between the US position on the allowable dose and the international position based on an actual difference on how that radiation dose will translate to human health, or is it based on a difference in risk tolerance between the U.S. and the international organization, or is it more complicated than one of those choices?
I think there's a few factors. One is the difficulty in measuring, and also the difficulty in being able to monitor it as a patient goes around, you know, say going from one doctor's office to the other. I know it's been talked about, it's been considered, but I'm not aware of that happening in this country. Or
No, I'm talking about the difference between the 5 REMs and the 2 REMs. I think she's also answering my question. Okay.
Oh, yeah, sorry. I believe that is being done in some other countries, but I'm not certain that there's any considerations in this country at this time because of the complications, many complications in measuring, and the logistics of being able to, you know, having the patients, I guess, track that.
So there's no standard that says this is the absolute maximum that anybody should be exposed to.
No. That is up to the discretion of the physician, and that's not regulated, not by the Nuclear Regulatory Commission. What we regulate is occupational exposure.
Lemit, do you want to take the issue of to what level we harmonize and impact on access?
Well, I don't know if I got the access question right, but I think there is sometimes really the worries that if you go with the harmonization to the international standards, that this may have also cost implications, and this is why people should not do it and postpone it. Now I can bring only one very straightforward and probably interesting example. When WHO was getting involved with access to the antiretroviral therapies, when the HIV pandemic was already out, the average cost per patient per year, I may not recall it exactly, but it was probably something in the range of $15,000. Today, the same triple first-line therapy can be provided to the people with something around probably less than $300, some case maybe $100 per patient per year. Now, these medicines that are doing that are at large those who have US FDA tentative approval for the PEPFAR program, or WHO pre-qualified medicines. WHO was the first to pre-qualify the triple therapy for the HIV/AIDS. So, are these medicines substandard? No, they're not. They are just quality generics. They are international standard quality generics, not just any copy drug from somewhere not meeting international standards. Now, competition based on the same standards, which is fair competition, I would say, is bringing prices down and making things affordable, where possible. We could end it. But this is something that I think sometimes in the developing countries is probably, as they are largely generic markets. This is where the worry is. Increasing standards may increase the cost of generic essential medicines, and this may not be workable. If you have competition and fair competition and no artificial trade barriers, second standards, double standards, whatsoever, this is achievable. But if you have this type of all other layers, then of course probably this doesn't work. So it's again a bit to think about. Now the next thing was that I got a good comment that what next? And I think it's a very good comment, and good comments are good because you don't have always good answer, because this is why they are good comments. Otherwise, they're not good comments. Now, of course, I could put forward some very straightforward vision how it could go and what could be done, but they are merely some suggestions which may not be, of course, comprehensive or the best. But one is that WHO had at some time point a very interesting guideline for small regulatory authorities. And when you read it through, actually, it's listed that all the well-resourced regulatory authorities should do. And it's very good, because it gives the full spectrum of what should be done. But it doesn't say how you can do that, because if you read it through, in sitting in country X, you can realize immediately it's not doable. It's all nice, it's all correct, but how you can do it with 2 people or 3 people or 30 people? So I think we should revisit this guideline and completely rewrite it based on today's realities, trends, and what is happening. We are collecting some best practices. There are some best practices how small regulators have started to be more smart, how they integrate themselves into the collaborative networks, and how they capitalize on that, and trying to focus on the things that they locally can do with added value, which makes sense. And there are a lot of things like that. So I think we should a bit tune our focus of thinking and trying to give people options and best practices how you could manage the situation. Just saying it's not doable or you can't do it doesn't lead anywhere. So, and another thing which is also partly related to that is, there was yesterday talk about, I think several people also mentioned good review practices. Also good review practices, which some of the harmonization initiatives are actually now thinking how to go forward. We could also pick it up and look how we can build some sort of a vision and understanding how you could do the things for the good review practices. Some elements can be also built into this, some sort of a higher level guidance. So there are some avenues to try to take it structured consultations forward and try to do something, and we'll likely go in this pathway. Whether we will be successful, that's a different story.
Okay, so we need to wrap this session up. Can we make the comments or questions really short, and we'll try and close the session. Thanks. Would you like to go?
Okay, thank you very much. I'm Chimome Chamdimba from NEPAD. My question mainly is going to Cindy. I think it's on the implementation aspect, because I think according to your presentation, it's more on alignment and it's a voluntary basis. It depends on the country what it wants to adopt, and in terms of the regulations, the international standards. I'm just wondering, what is the situation in terms of countries adopting the international standards in this regard? Would you have an idea of such, that information in terms of how are countries moving forward towards adopting the international standards? Because when we are setting international standards, the idea is we want countries to align to them, if possible, adopt them. So how are we doing in that regard? Thank you.
Yes, please go ahead.
Thank you. Paul Copeland, Purdue. Wanted to follow up on something that Dr. Rego mentioned about how groups that were working on harmonization that had a good secretariat were much more likely to be successful. And I think that's a really, really important point. 15 companies been working to develop a class REMS, a shared REMS for opioids, and once we got a good secretariat who was independent of any one player, it moved ahead so much quicker. And I think it's something for us to just consider.
That's great. Thank you for that. So, final comments from the panel.
With regard to ICRP's recommendations, they get adopted by the IAEA's basic safety standards oftentimes, which means that the European nations are, I believe, required to adopt them. So you'll find that the European countries will need to adopt them to some extent. We're not bound by that. So you'll see that the European nations will need to, and I don't know how far that extends beyond that, and what other countries have to. And that's why you'll see that we will not align the way that some other countries will.
Thank you. So I think we've had a great session, a lot to look at. I think some of the final comments on possibilities of work sharing as well with regard to harmonization, something else that we can look at, I think. But many thanks to you, and I'm going to hand it back over to Tom now.
Thanks.
Well, Steve.
Yeah. We will start again at 10, and before we go away, I want to just share a somewhat sobering, depressing but humorous at the same time note that I got from Tracy Lustig, our staff for the meeting, and she wrote me that the very first study of the National Academy of Sciences in 1863 was whether the U.S. should convert its weights and measures systems to be aligned internationally, and the recommendation was yes.